Hello guys! Welcome back to my channel. This is Dr. John the Dentist, and for today's video, we are going to talk about receding gums. So a lot of people are asking what is the main cause or the main root of having receding gums or gingival recession, and we are going to talk about the causes, the signs and symptoms, the possible treatment options for this kind of problem. So if you are wondering what is this all about, stay tuned and finish this video. So if you're new to my channel, don't forget to subscribe and like this video, and also click the notification bell for you to get notified whenever I upload new videos. And also if you have questions, suggestions, reactions with this video or with my other previous videos, you can comment it down below for me to know what are your other dental concerns. And also if you have questions, dental fees, how much is this treatment, how much is this procedure, unfortunately I can't give you this answer in YouTube because it is unethical for me to answer those questions, and also just to give respect with other dentists and other dental professionals. So thank you very much for understanding. So now let's go back to our main topic, which is gum recession or gingival recession. So basically, when we're talking about gingiva or recession, or in Tagalog, pagbaba ng gilagid, normally we are talking about not only one tooth, but sometimes it is generalized. So when we're talking about gingival recession, we can classify it to localized and generalized gingival recession. So when we're talking about localized, it is most likely on a specific area only. So it may affect one tooth, two teeth, three teeth. But if when we're talking about generalized gingival recession, normally it will affect all the teeth in our oral cavity. So now let's talk about the signs and symptoms of gingival recession or gum recession. So first on our list is if you can feel any sensitivity, that's one sign of gingival recession. Why is it that you may feel sensitivity or discomfort when you have gingival recession? So let's first talk about the anatomical structure of the tooth. So this is how our teeth looks like anatomically. So in our tooth, we have crown and we have the roots. Normally, the crowns and the roots are covered with enamel for the crown and cementum for the roots. But normally, the cementum is much thinner compared with the enamel. And we all know, after the first layer that covers the tooth, there's the dentine. And dentine surface, it's more sensitive to any form of outside environment, like cold drinks, sweets, colds, hot. So those things can cause sensitivity to the dentine. The problem is the cementum surface of our root area is thinner compared with the enamel. And usually, it is a sign that if we are experiencing sensitivity and discomfort, there's a possibility that there's a gum recession. Second on our list for signs and symptoms is bleeding upon brushing. So usually, it is an early sign of gingivitis when we experience bleeding or pagdurugo ng gilagid. It is not normal to experience bleeding, specifically if we are just applying mild brushing on our teeth. So it's a sign that there's a problem or an incoming problem to our oral health. Third on our list is if our teeth looks longer than other teeth. If we are experiencing gingival recession on a localized area only, or in one tooth, or two teeth, or three teeth, usually the other teeth looks longer compared with the other teeth. Fourth on our list is loose teeth, or in Tagalog, gumagalaw ng ngipin. So basically, if we are experiencing loose teeth or tooth mobility, it is one sign that there is an underlying problem within our periodontal health, which is later I'll explain or I'll be discussing on the causes of gingival recession. If we are experiencing tooth mobility from moderate to severe mobility, there's a big chance that we have problem for periodontal health that may lead to gum recession or an early sign for gum recession. Alright? Now let's talk about the causes of gingival recession. Usually, the first cause of gingival recession is excessive toothbrushing. Alright? Excessive toothbrushing is specifically wrong brushing technique and wrong use of bristles. If we are using hard bristles, in our toothbrush there are soft, very soft, there are medium, there are hard bristles. As much as possible, we have to avoid using hard bristles. Why? Because excessive brushing may lead not only gum recession, but it can also cause the so-called toothbrush abrasion. And this toothbrush abrasion, it is more of we are removing the first layer of the tooth, which is the enamel surface, and it may lead into a concave-like depression on our teeth, specifically in between the gums and the teeth. Most likely, this will cause you sensitivity after. And if you don't stop using or doing the wrong brushing technique, it may lead to pulp exposure after if it gets more severe. Alright? Second on our list is poor oral hygiene. So basically, if we don't brush our teeth, it may lead to gingivitis, which I have a video right here if you want to learn more regarding gingivitis, which you may learn a lot. Number 3 on our list is hormonal level. So sometimes women, you experience estrogen increasing, pregnancy, puberty, so possibility it may also cause gingivitis and some gingival problems which may lead to gum recession. So we have to take note that we really need to have proper or good oral hygiene, specifically if you are women experiencing puberty, experiencing pregnancy, or if you are taking birth control pills, you have to take note of this one. Right? Fourth on our list is tobacco smoking. So we have to take note that tobacco smoking is also one cause of gingival recession, because tobacco or smoking cigarette increases or it makes our dental plaque more sticky. So the bacteria will adhere more on the surface of our teeth, which may lead to gingival problem or formation of calcular deposits and so forth. Then it will lead to a more serious problem. Number 5 on our list is grinding and clenching. So if we have this habit, or if you are familiar with night grinding, at night you make sounds when you're sleeping, it is one of the problems that may lead to gum recession. Number 6 on our list is crooked teeth or misaligned teeth. So if our teeth is not properly positioned, if our teeth is not in straight formation, or if we have crooked teeth, or in Tagalog, bakod-bakod na mga ngipin, there is a chance of first calcular deposits formation. Possible, the force that is being applied on the tooth may lead to gum recession because there's heavy pressure that is being applied on our teeth. Last on our causes is periodontal health concern. Periodontal health concern or periodontal disease is one of the major causes of gingival recession or gum recession. Once periodontal disease starts, it is hard to stop because once the bone recedes or it goes down, there is a chance that it is really hard to stop. You have to maintain it. Or if you can compare it into a systemic disease, you can compare it with diabetes. Once that you get this periodontal health problem or periodontitis, it is more likely that you'll have it for a lifetime if you were not that good in visiting your dentist and if you are not that good in preserving your oral health. Right? Just an add on to the poor oral hygiene, improper use of tooth floss is one sign or one cause that may lead to gum recession. So if you are just doing up and down with the floss, it is not good, right? Because you are just pulling down the interdental papillae. So what is interdental papillae? This is one. Alright? So one sign also that you are experiencing gum recession, okay, is you can see this black triangle in between of your teeth. So this is what the black triangle looks like. So black triangles is a sign that you are experiencing gingival recession. Sometimes it is part of the periodontal health problem or periodontal disease, but sometimes it is caused mechanically through wrong use of tooth floss, and sometimes those people who are fed with toothpicks. I know that the term toothpick is referred for tooth to remove the debris or the food stocks in between the teeth, but it's not advisable to use toothpicks or straws or anything that may lead the interdental papillae to go down, because once the interdental papillae goes down, it will never goes up. Right? It is hard to pull it upward again. Right? So we have to be very careful in using this kind. Or if specifically for tooth loss. If it's more of toothpick, I suggest stop using it when removing debris or foods that stops in between in our teeth. So what are the possible treatment options that we may consider for gum recession? So first, if you are using toothpick, you have to stop it. If you are smoking, you have to stop it. So you can treat the problem. But if the gum recession is already present, first treatment that we may consider is routine oral prophylaxis or cleaning, because cleaning can treat gingivitis. But if we are experiencing severe or moderate to severe gingival problem, we may consider deep cleaning or deep scaling together with root planing. What are these treatment? So deep scaling and root planing is very essential, specifically if we are removing debris or calcular deposits that sticks on the cementum area of our teeth. So it is literally planing or removing completely those calcular deposits that submerge into our teeth. Stop bone recession, right? So if there's a problem like gum recession already, there's an observed presence of gum recession, we can do surgical treatments for this kind of problem. So we have soft tissue grafting, which is most likely, this is soft tissue grafting looks like. If you are experiencing localized gum recession, there's a big possibility that you can use tissues in the palate surface of our mouth, then most likely it will be placed on the area where there's a gum recession. Sometimes, if it is not that required to do grafting, we can also do gum repositioning. We will do incision on the gums, then we will just deplace it on its position so that we can cover the area wherein there is a gum recession. So this is how it looks like. So basically, we're just pulling up the gums, then we're just going to cover the area where there is gum recession for it to cover, and then to avoid any problems or any sensitivity on our teeth. And hopefully, I'll get to see you again next time. Bye-bye.